Shelley von der Lanken. I'm a full-time faculty member at St. Louis University School of Nursing.
So you used to work at St. Louis University Hospital, and what did a typical day of nursing involve for you?
So for a nurse at SLU, we're a level 1 trauma center, and I worked in a trauma, on a trauma division. So the nurse would have 5 to 6 patients. The patients were of very high acuity. We would have victims of violence or trauma, and we would be responsible for managing the care of those 5 or 6 patients, including discussing with physicians, social workers, all of the other disciplines in order to facilitate care and to inform the patient as best we could in preparation for discharge.
What does high acuity mean?
It means just the patients are very ill. Versus when I first started nursing, we used to have patients stay in the ICU a lot longer. Patients are staying in the hospital for much shorter of a period of time, and so we took care of patients that were much sicker. And so the challenge for nursing really these days is to be a patient advocate, be a patient educator, get patients ready for discharge in a very short time frame.
What's your most favorite part of nursing?
Taking care of patients, really, and being a patient advocate. I think nurses have to not forget about that, and really I think I have so many friends who have gone into other professions and gone back to nursing or back to occupation or physical therapy so that they can make a difference. I think when you're a nurse, you really make a difference in people's lives, and that sense of satisfaction is really what it is to be a nurse.
What's your least favorite part of nursing? Or your least favorite procedure to do? Or
I think sometimes the stress of trying to manage many patients who are in great need. I think that's very difficult for I think even the best clinician. It's very difficult, I think, because patients really need a lot more than they ever have. It's difficult and stressful sometimes to try to do the very best job you can in an environment that sometimes isn't conducive to that.
For a Master's in Science of Nursing, you must have a BSN. It provides advanced training for nurses who wish to open up their own nursing practice, find work as a clinical nurse specialist, or become an educator in the field. It generally takes between 18 to 24 months of full-time studying to complete. However, some programs require 3 years of study beyond the BSN.
Your name and your credentials?
My name is Holly Bogan. I am an LPN. I've been an LPN for 6 years now.
What kind of schooling did you go through to?
I actually lived in Virginia Beach, Virginia, and I went to Virginia Career Institute. My program was 14 months.
What brought you to St. Louis and specifically to this assisted living center?
I am actually from St. Louis. My husband was in the Navy, and we lived in Virginia for 8 years, and we just decided to come back. As an LPN, you're pretty much limited to long-term nursing, some assisted nursing, so this is pretty much where you go as an LPN.
So what's a typical day of nursing look like for you?
Hectic. Very, very hectic. You have to remember you actually have people's lives in your hands. Decisions that you make should not be taken lightly. You should treat your residents and your family members like they're your actual family. You need to be very mindful of the decisions that you make. It's a fun profession, but it just needs to be taken seriously. You need to really understand exactly what you're doing and what you're here for.
So in the morning you start with assessments.
Usually I may pass medications. I pass medications for a couple of hours. I have treatments I have to do. I have morning meetings that I have to go to. I have care plan meetings I go to. And in between all of that, you have to chart. You have to address problems that may happen. People get sick. People have falls. I mean, anything can happen. So you have to kind of plan your day where you're ready for anything. Just because you plan your day a certain way doesn't mean that it's going to basically go that way.
How long are your shifts here?
Our shifts they're 8 hours now. We tried the 12 hours, but didn't quite work out that way. I think I like 8 hours better.
What's your least favorite part of nursing?
Losing patients. I don't like when I lose my patients because you get attached to them. You learn to love them, and when you lose them, it kind of takes a toll on you.
What's your most favorite part about nursing?
Meeting different people. You, as a nurse, you're exposed to people of all aspects of life. You never know who you're going to get. You just a different pace every day. I mean, some days are better than others. You know, you never know who you may meet, who you may have.
Can you think of a specific story or like that's been your most favorite part, or?
We have a resident now. I'm just gonna call him Mr. F. He very demanding. I think he is my favorite resident on this floor. Very demanding. When he asks for something, he expects for you to stop what you're doing, no matter what it is. Even if it's with another resident, he expects for you to stop what you're doing and listen to him completely. You have to give him your undivided attention, or he makes you give him his undivided attention.
This is great. Thanks, Holly.
You're welcome.
For a licensed practical nurse or an LPN, you must go to school from 7 months to 1 year. You earn $35,000 annually, and you must take an NCLEX PN certificate examination to become nationally certified. Okay, we're going to show you a demonstration of our lab and what we would do to start an IV on a fake dummy hand. So we have our fake dummy hand right here, and first you would take a tourniquet and tie it as tight as you can around the arm, which will help you find a good IV. So you tie this as tight as you can, and you only do a half knot so that it's easy to release after you find blood. Alright, so we have the tourniquet on, and now you're going to look for a good IV. There's a big vein right here for us to start an IV. So first you get your alcohol prep, and you wipe off the vein that you're going to start your IV on. You can see the vein popping out. Alright, and then this is for drawing blood. This is a butterfly needle, and we're going to open that up.
You know what's funny?
And you take the cap off, and then there's a small needle, and you want the top of the needle, the bevel, to be facing up. So then you grip these two together, and you just stick into the vein. Alright, well usually when we stick an IV in, you would get blood return, and you will see it fill up this. And then when you get blood return, you can draw a blood sample. So you would take this syringe and open the IV, and then you would draw back, and oh, there's blood return. And then you would get your blood sample. Then once your blood sample's full, you can take that off. Alright, and then that's how you would get your blood sample, and then you would take the tourniquet off and use a gauze pad to take out the needle. For a registered nurse, you must have an associate's degree, which takes 2 to 3 years. You must pass a national NCLEX RN test to be certified, and in 2009, RNs made $63,750. When getting a bachelor's in science of nursing degree, you will get a greater understanding of healthcare theory, nursing administration, and nursing research. You must also pass the NCLEX RN to be nationally certified, and they earn $74,000 annually. For a nurse practitioner, this credential is earned by taking graduate-level nursing classes and passing an official nursing practitioner examination. The average salary for all nursing specialties was $86,464. There are many different career options for a nurse practitioner, such as a nurse anesthetist, a head nurse, a nurse midwife, a nursing education director, and a clinical information systems consultant. Some typical nurse practitioner specializations are family nurse practitioner, who provides care for all members of a family, an adult nurse practitioner, who works with adults over the age of 21, geriatric, who works with the elderly, neonatal, with newborns up to 21 days of age, and acute nurse practitioners, who work solely with those who have acute illnesses or diseases.